you know, it needs a lot of practice. So what we will be doing today is we will just be really kind of doing an introduction and going over the basic parts of motivational interviewing. Uh-oh, I'm having trouble getting my, there we go. I am from the Macmillan Center for Health Education, and I'm located in Fort Wayne, Indiana. And at the Macmillan Center, we do every type of health education there is. We teach nationwide. I happen to be in our film studio right now doing this webinar. We do nationwide education live through our film studio, but we also go into a lot of schools and community groups. We will educate about 50,000 youth and adults face-to-face, and we've been doing this since 1981, and we are a nonprofit. I started my career in home visiting and in supervising home visiting programs, and that was really where my interest in motivational interviewing came about, was in working one-on-one with parents and families. And I spent part of my career working with families in crisis who had children who were in multiple systems, and motivational interviewing was a big part of that. Now, mostly I teach it, and a lot of it is to groups who work one-on-one with children or families. And in Michigan, you probably know us best for this, our BRUSH program. This is our oral health program for early childhood education. We have about 100,000 children nationwide enrolled, receiving our BRUSH curriculum. All of the women, infants, and children in WIC in Indiana are receiving BRUSH oral health materials. And then we just integrated into Detroit WIC. So I just was up there about 2 weeks ago training the WIC staff there. So it's a very exciting integration. So I do a lot of work in oral health. While the center that I work for educates on every single health topic there is, like bullying and drug prevention and how babies are made, and my main focus is predominantly on oral health. So today we're going to learn about motivational interviewing techniques and how they can help us reframe our communication, especially the questions that we're asking people. And we're going to gain knowledge of some of the behavior communication strategies to encourage behavior change. And this is specifically the OARS approach, OARS approach in motivational interviewing. I did not develop this. This is the kind of the standard approach to motivational interviewing, and we'll go over what those components are. But to start, this is the most recent, the current definition of motivational interviewing. And this definition has changed. Motivational interviewing has been around since the 70s. And it was originally developed, it originally came out of the alcohol addiction world. I kind of like that, because if you want to talk about difficulty in changing behaviors, drug and alcohol addiction is probably your #1 difficulty of changing behaviors. So I kind of feel like if it was tried and tested there, it's pretty good. But basically, if you look at this definition, that it's a collaborative, person-centered form of guiding to elicit and strengthen motivation for change, there's a couple of words that really jump out there. The first being collaborative. In health, we tend to sometimes be very direct in our communication. It's sort of, you need to do this, 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 and this. That's not collaborative, right? Collaborative is back and forth. And ideally in motivational interviewing, the professional provider should be talking a lot less. And then we're really looking to strengthen motivation for change. So this is really all about change. Motivational interviewing is really used when we have patients that need to do a behavior change for the good of their own health or for the good of their children's health. And we're working with them to try to work through some of the barriers and understand where they're coming from, and really help strengthen that motivation for change. Now, when I do this live at this point in the training, what I do is I ask for people to give me some examples of some things that they're really struggling with, some specific communication examples of things that they're struggling with, and then I use those throughout the training. If you have anything, go ahead and send that to Victoria, and she can let me know at any point here, and I'll use that as an example. A lot of the really typical examples I get are dental follow-up. Someone brings in, especially a child, who needs a lot of follow-up, and those follow-up visits aren't made. Even simple behaviors like just getting people to brush twice a day, to do that oral health at home is a really common one. If I'm with home visiting groups, then we get into a lot of really exciting ones like home environment, lice, and things like that. But with oral health, what I typically hear a lot of is nutrition. Practices going on that are dangerous to teeth, like the sippy cup with something sweet in it all day, bottles in the crib, a lot of follow-up, and then a lot of daily oral hygiene. And the question I get a lot is, do you need to use motivational interviewing with everybody? Yes and no. There are certain aspects of motivational interviewing that are very helpful when they're just worked into every time we have a conversation, and we'll go over what those are. However, then there are some people that are more difficult as far as eliciting a motivation for change. You're really struggling with that. Those are the people where getting really more in depth with the motivational interviewing can really help. And I had a great example yesterday. We are developing materials, oral health materials, for parents with children with disabilities and the professionals who work with them who are not oral health professionals. So I'm talking your home visitors, your early Head Start. In Indiana, it's called First Steps, our home visiting program for children with disabilities. And I was having lunch with a pediatric dentist to get some background information from him on the specific things I was getting out of my parent interviews. And he was sharing his morning with me, and he said he had just done a number of extractions on a 4-year-old. And he said, this 4-year-old was in a couple weeks ago when we scheduled this procedure, and I told the parents they've got to be brushing twice a day. And now I have him in this morning to do all these extractions, and I look at the teeth and I can tell they haven't been brushed at all. And he said, I looked at the parents and said, you have got to be brushing his teeth twice a day. And he said, they just looked at me with blank stares, deers in the headlight. That's where motivational interviewing, it really comes into play. That's the type of clients where it's really, really important to do these types of techniques when you're really feeling like, oh my gosh, they're not getting this. Everybody works with parents or individuals who they want to do everything right. All you have to do is explain it once and they're off and running. It's not as important for those people, but there are some nice little things you can work into for even those types of patients. So motivational interviewing really focuses on why we resist change. And when we are trying to get people to change their behavior, brush their teeth more, come into the dentist twice a year, whatever it is we're trying to do with them, we get a lot of resistance, right? People do not like to change. In fact, change is on every national survey that's ever been done about what people don't like, change is always at the top. And why do we resist behavior change? These are the main reasons. Ambivalence. It's not that important to me. I'm uncomfortable doing that. A lot of times I don't really even understand what you're asking me to do, so it's making me uncomfortable, and I'm pretty happy with the way things are. This really falls into when we ask people to change their diets or, ask them to change their feeding practices with their children. It's like I'm comfortable with the way things are. I don't want to do this. Not a priority. This is a big one in oral health. Often oral health is not a top priority. It's actually a big one in everything. Often physical health is not a top priority with people, and they'll flat out say, this just isn't a priority. It's not that important to me. Or stress. When we work with, especially our low-income populations, we have to understand that they face a very high level of stress, and often a very high level of chronic stress and toxic amounts of chronic stress. When you are facing chronic stress, it is really hard to make anything happen in your life that is not, in your mind, an absolute imperative. For instance, if you're facing losing your living situation, you're facing eviction, brushing your teeth twice a day, probably not going to be a high priority for you. So often what I say with people facing a lot of stress, and we see this a lot with home visitors, is we've got to deal with that first before we can deal with what we want to deal with health behavior. Because the reality is they may have bigger priorities right now in their lives, and we've got to help lead them to help with those before we can work on what we need to work on with health behavior changes. If you're worried about feeding your children, and worried about, losing your job, or you're in a domestic violence situation, those are much higher priorities in your life than taking care of your teeth or your physical health or those things. So if you look at the research, and there has been quite a bit of research on motivational interviewing, it's been found to be effective in reducing maladaptive behaviors. They've really more research studies have focused on alcohol, gambling, HIV, risky behaviors. So motivational interviewing studies have typically focused on our extremely risky behaviors, like our addiction behaviors or our HIV risk behaviors. But it's also been found to be effective in increasing adaptive behaviors, and increasing positive behaviors in exercise, diet, and medication adherence. I'm not aware of any studies done with motivational interviewing that are specific to oral health. I'd definitely be interested in seeing them if they're out there, but I in my searches, I have not been able to find them. However, motivational interviewing is becoming very common, especially in the nursing world, and becoming much more common because this is a really huge frustration of anybody in a health profession, is that people are not as healthy as they could be because of the certain behaviors that they're doing, and getting them to change those behaviors is extremely frustrating. And it's probably one of the number one frustrations that people express is, I've told them and told them and told them and told them, and still this continues, and they're still unhealthy because of this, whether it's oral health or general health or mental health. This is a big frustration. So motivational interviewing can really help with this. So this is the traditional model of communication in the healthcare professions, all of them. The healthcare professional is the expert, and they tell the patient how to change. The patient does not have the knowledge, and the provider is there to give the knowledge and give the instructions and tell the patient how they need to change. And this is very traditional. This is kind of what we're used to. This is how it's set up. The problem is this doesn't really work that well, right? Because if this worked, we would have the world's healthiest population. I think all of us have sat in a physician's office and been told we need to do something. If we would just leave and do it, we would never have any issues whatsoever. I'm pretty sure anybody who smokes has been told by a physician, stop smoking. You need to stop smoking. Do we do it? Not usually, right? And so that becomes then the problem. This traditional model is just not that successful. If we could just get people to change the minute we tell them to, we'd have solved all of our problems. As a parent, this is also kind of the traditional parenting model. And if I could just get my children to do everything that they need to do the first time I told them, I would have no issues as a mom. So the motivational model is kind of the opposite. The patient is their own expert. So here's the reality. When we're asking somebody to change, we don't know what their daily life is like. We don't know, what they don't know, what supports they need. We don't know that. And that's really what impacts why they don't change. However, they know that, but we rarely ask them. So in the motivational interviewing model, you're working in partnership So it's not the healthcare professional telling the patient what to do. It is a partnership of working together. The patient is the one with the resources and the motivation to change. And the provider needs to try to evoke this from the patient. So the provider's job is to try to probe and find out what's going on with the patient so they can move them towards change and give them resources that they need if they need those resources and knowledge. But often they don't. Most people know what to do. There are very few people who don't know that they should be brushing their teeth twice a day, and yet we know a good part of our population doesn't do that. It's not a lack of knowledge. So when they come into your office and you say you should be brushing your teeth twice a day, yeah, I know. I already know that. There's a reason they're not doing it, and the only reason you can find out why they're not doing it is to talk to them about it. So here's how we tend to communicate. You have a problem. Here's how to fix it. You need to be brushing your child's teeth twice a day. Do it. If not, I'm going to be extracting the rest of these teeth. So that's a very traditional model, and unfortunately, it's often not successful. Motivational interviewing is kind of coming at it from, what do you think the problem is? How do you think you can solve it? Often what we think the problem is not what the patient thinks the problem is. And the reality is they're right? Because perception is reality. So although we perceive the problem to be, you don't brush your child's teeth twice a day, and that's why I'm doing all these extractions, the parent may have a very different perception, and we've got to start with where they are at and work from there. Otherwise, we just don't get anywhere. So motivational interviewing allows the patient to be heard, and to be part of finding the solution rather than just being told what they need to do. And this is really important because if we want people to actually change, they've got to be part of that buy-in, right? It doesn't work when we just tell somebody what to do, and then they leave our office, and we know probably in a lot of cases they're not going to do that. You can get a feeling when you're talking to somebody, like the dentist said to me, they're just looking at me like deer in the headlights, no response. He said, I know they're not going to do this. He was right. They're not going to do it. And, he was absolutely correct. And when he told them before to brush their child's teeth, they didn't do it. So you need to get to the bottom of why aren't they doing it? And sometimes it's as simple as they don't know how to do it. And that's something we often overlook. So motivational interviewing allows the patient to be heard and to be part of finding the solution instead of you just giving them the solution and saying, here's your solution, now go home and do this. So here's the deal with motivational interviewing. It takes more time. This is the reality. And this is why I say, when people say, do I need to do this with every single person? Because I literally don't have time to do this. That's absolutely right. The reality is you probably don't have time to do in-depth motivational interviewing with everybody. There's some quick things you can work in with everybody, but are we going to go through the whole OARS approach with every single person? No, we don't need to, because there are a lot of people who, using oral health as an example, are doing a wonderful job. You don't need to do all this with them. They're doing a great job. But when we're trying with the people that do need behavior change, we often don't identify the problems that they're facing because we ask questions in a way that's really quick for our schedule, but it also encourages people to be less than truthful. So for instance, when toothbrushing is addressed in the typical, you're brushing your teeth twice a day, right? There is only one answer, and that answer is, right, sure. Is that the truth? Often not. But we all do this. We all get in, and I use the annual physical as an example all the time. We sit there and we're already uncomfortable because we're undressed in a cold room with the tiny little paper over us, and the nurse or the physician comes in and says, you're exercising 3 times a week, right? Right. Okay, I'm not, but I plan to, I want to, I know I should. So I give the answer they're looking for. And then they say, you're eating 5 servings of fruits and vegetables a day. And I say, because again, I know the right answer and I know I should be doing it and I plan to do it. And some days I do it, but some days I don't. So we get a lot of misinformation from people because the way we ask questions is fast and convenient for us, but it really encourages answers that are less than truthful. So to turn that around, if the nurse came in and said, tell me about how you're moving during the day, I would say, oh, and if she specific or he specifically said, tell me about how you moved yesterday, I would say yesterday. Okay, I really spent most of my day sitting in meetings, and then I went home, got the kids dinner, and spent the rest of the evening on my laptop working. And if they said, well, is that a typical day for you? I would say, yeah, you know what? That is pretty typical for me lately. There's a big red flag, right? I am not moving enough. And I cop to that. I'm not moving enough. But had they said, are you exercising 3 times a week? I'd have been like, yeah, sure. Because I plan to do that. Like starting next week, I plan to do that, which I've, for the past 6 months, said that every single week. Next week, I plan to do that. So there's different ways we can ask questions that encourage truthful answers versus the fast answers. If the nurse had said, tell me what you ate yesterday, instead of you're eating 5 fruits and vegetables a day, right? Tell me what you ate yesterday. Now, yesterday, thank goodness I did eat pretty good. But, you know, that gives a much more truthful answer instead of you're doing this, right? We all know what the right answer is. Most of us know what the right answer is. We just aren't always doing it because we're busy or we're stressed, or in my case, right now I'm working too many hours. But in an ideal situation, when going through a list of questions like that, the patient should be talking a lot more than the provider. It shouldn't be those one word answers. And we're going to talk a little bit more about how to set up questions so we're not getting those one word answers, because those one word answers are often not true. They're just what we want to be true, like the weight on our driver's license. It's our goal weight, not our current weight. So I already kind of went over this. So when we say you're brushing your children's teeth twice a day, right? And I have to tell you, I have never had that question asked any different way. When I bring my children in for physicals, this is exactly how it is always asked. And I've changed providers because we've moved several times as I've been raising my children. So it's not just one provider. This is how it's done. You're brushing their teeth twice a day, right? Right. Now, I actually do that. But if I didn't, what would my answer be, right? So if they would say, tell me about toothbrushing in your house, well, might get a little better answer there. Might get an answer that kind of says, well, you know I should be doing it twice a day, but evenings are really tough in our house, and, and just really can't get to it most evenings. And then we could go a little deeper, and say, well, have you thought about maybe just brushing right after dinner? Is that something that might work in your household? Oh, well, I thought I had to do it right before bed. Well, you know what? If they're not eating anything after their evening meal, no, you could just do it right after dinner. And so kind of trying to work with what's your situation, what's your scenario, what are some resources I could give you to help, but working within your life. Because the parent may say, well, no, actually that wouldn't work because, of some reason. And then you kind of take it from there. But letting them talk about what their reality is versus us imposing on them, this is what you need to do. You just need to do it. But saying, does this work for you? Tell me about what's going on with you. And working together to find a solution that can work for their life, their schedule, their child, what works for them. If you guys have any questions as I'm going through this, please just send them to Victoria, and Victoria, just interrupt me if there's questions. And I'll just answer them as we get them.
Okay. I haven't gotten any questions yet so far.
Okay. So this just recently happened to me when I went in for my last physical. One of the questions they asked was about stress, and I just laughed because at the point of that, I was getting ready to defend my dissertation, and I was probably at the highest stress level I had ever been in my life. And so they said, oh, well, if you're really stressed, you need to exercise, eat healthy, and get more sleep. And I thought to myself, well, duh, I know that, and none of those things are going to work for me right now. So what would have been more helpful to say was, if we're dealing with somebody who says they're very stressed, to say in the past, if you felt stressed like this before, what's worked for you? So rather than saying these are the things that you need to do to reduce stress, we say instead, what's worked for you? The patient is the expert on what their life is like, what has worked for them in the past, what things they would be willing or not willing to do. So we need to ask them to share their expertise on their own condition. So if they say, for instance, I can't get, my daughter won't let me brush her teeth, we can say, has this happened before? And if it has, was there something that you tried that worked for you? And then they might say, no, it's never happened. I need some help here. Or they might say, yeah, you know what? Her older brother did this too. And I bought him one of those little electronic toothbrushes, and then he really liked brushing after that. So helping them jog their memory of, have you dealt with this in the past? Often when we're in the middle of a stressful situation, whether it's a child refusing to brush or us being under stress, it's really easy to forget. We might have dealt with this before and we might have dealt with it successfully, but if we're prompted, then we can kind of call on our memory to say, oh, yeah, you know what? I actually have dealt with this before and here's what happened. And then we could say, and if they said, well, we tried this with her brother and it worked, well, do you think that might work with her too? Maybe that's something you could try. Yeah, maybe it is. Or they might say, no, that wouldn't work with her. She hates loud, noises. She would never use an electric toothbrush. And then you could say, well, maybe let's work together. Here's some things that have worked for other moms in this situation. Let's talk about maybe if one of these might work in your situation also, instead of saying, well, here's what you need to do. You need to do this, 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 and this, and then walking away. I had my youngest son is in speech therapy at school. And speech and fine motor skills go hand in hand with each other. I did not know that. When I went in for his school conference in the fall, he was having some issues with fine motor, and he's in second grade. And the teacher said, he's having some issues with fine motor, so here's what I want you to do. Here's a number of activities that I've pulled for you to work on him every night with. And she handed me the activities, and she said, I'd like to work on you to work on these activities every night with him. And I looked at the activities, and they were really girl-oriented. They were lots of crafts and stuff like that. And there's no way my son would do that. And judging by the pile, it was about 2 hours of stuff every night. Now, I have a heavy travel schedule. At that time, I was, really in the midst of a lot of big projects. There was no way I could dedicate 2 hours. And I love my son to death, and I want to do everything for him. It wasn't feasible for me to do this, and it wasn't feasible for him because he was going to hate doing it, and it was going to turn into a nightmare of me trying to force him to do this stuff. So I left the room thinking, there's no way I'm doing this. If she had followed up with my son and said, are you doing those activities I gave your mom? The first thing he was going to say is no. And then she was going to think, great, here's a bad mom. I told her to help her son with this. She's not doing it. There's no compliance. The reality was I went online and found some different activities that he would enjoy that would take about 15 minutes a night because that was more reasonable. Now, all she would have had to do was say to me, I have these activities here that I've given to other parents. Do you think this would be feasible for you to do? And I would have said, no, this is not feasible for me to do. James is going not to enjoy these activities. And I honestly, I don't have the time right now to do that. And then we could have worked together to find some other alternatives, but she didn't ask that. She did the typical model of James has a problem. Here's how you need to fix it. Go home and do this. And where it broke down was where it always breaks down in the go home and do this. I went home and didn't do it. Now, because I am a really motivated parent, I found other things to do, but a lot of parents just wouldn't have done it. And that's what we see a lot in oral health and in primary care is that lack of compliance and that frustrating lack of compliance. Most of that lack of compliance comes right at that point where we don't say, is this feasible for you to do given your daily life? That's a question we need to be asking a whole lot. When we say about brushing twice a day, is this feasible? You know, how do we work on making this feasible? How do we work on fitting this into your schedule? So this is the OARS approach. That is, if you go to any motivational training and motivational interviewing training, I'm fairly certain you're going to see this. This is kind of the hallmark of motivational interviewing. It's open-ended questions, which we've really gone over a lot, affirming, reflective listening, and summarizing. So this is when we're getting into it a little bit bigger, and this is probably going to be reserved. Parts of this are going to be reserved for people that really need to do some much more major behavior change. Open-ended questions, I've talked about. We want to avoid those yes/no questions. We, instead of saying you're brushing your teeth twice a day, right? We want to say, tell me about toothbrushing. And the open-ended questions we should be doing with everybody regardless, because you will find out a lot of interesting information when you switch to open-ended questions. Even as simple as, what brought you here today? You know, tell me about what brought you here today, or tell me about what's happened since you were in for your last visit. One of the very interesting things about open-ended questions, and the big one is, tell me more. Tell me about, and tell me more. So when I say, tell me about toothbrushing in your house, yeah, we're trying to do it twice a day. Tell me more. You know, and that's where, you know, you keep people talking so you can kind of really find out what barriers they're facing. But here's the deal with open-ended questions. The word why is an accusatory word. We do not want to use the word why when we ask an open-ended question. So when somebody says, well, I'm having trouble getting them to brush their teeth, we don't want to say why, because that comes across as accusatory. What we want to say is, oh, tell me more, or, you know, something along those lines. And I'll give you a really good example I did to myself in a training. I was trying to show people why the word why is accusatory. And if you think about it, you know, anytime you say something like, I'm going to do this, and somebody says why, you're kind of like, well, what do you mean why? So I was trying to prove this in practice, and I was at a training, and it was a long training, and the participants had been told to bring a snack. And the woman in front of me had a king-size Snickers bar. And so as an example, I said, okay, I want to show you how this works. And I said to her, why did you bring a king-size Snickers bar for your snack? And you know what she said to me? She said, it's none of your business. And I thought, wow. So she really felt that I was accusing her when I said, why did you do that? So I said, okay, let's turn this around. And I pointed at her Snickers bar and I said, tell me about the snack you brought today. And she said, well, I stopped at the convenience store on the way because I knew I was supposed to bring a snack, and I had a really bad morning, and I thought, you know, a Snickers bar will make me feel better. Now, if we had been in a more personal, you know, space, not in a big training, I would have said, well, tell me more. And, you know, kind of gotten into what was going on that was making her feel bad. But that's such a great example of when I said why, I got it's none of your business. And when I said, tell me about, I got the whole morning of, you know, I had a really bad morning and I think this will make me feel better. So if I was her primary care person, and she had any type of, was needing to lose weight or anything, I would see right there, okay, we've got to work on using food as emotional support. You know, we've got to work on that aspect of things, because she just shared with me that she's using food as her emotional support when she doesn't feel good. And that can lead, if you don't feel good a lot, that can lead to a lot of issues with weight control. So affirming. I always wrap this up in just being really nice. Always introducing yourself. I cannot tell you how many times I've been in a healthcare situation where the person has walked into the room and just started doing something to me without saying, hi, I'm so-and-so. It's nice to meet you. That's just kind of basic politeness, but it falls under affirming. Really, if anything positive has changed since their last visit, acknowledging it and affirming it. If you're a hygienist and you're cleaning their teeth and you look at the chart from last time and there were some issues and now you're not seeing those, saying, hey, Trish, you look great. I can really tell that you've made some positive changes. Your teeth look wonderful today. When they leave, thank people for coming in. And I think part of affirming too is explaining what you're doing so people can be positive participants in their health. When I was in for my last annual, the nurse walked in, didn't introduce herself, walked up to me and said, can you lift your sleeve so I can take your blood pressure? And I said, okay. And she took it, she wrote it down in the chart, she got up to leave. And I said, hey, before you go, could you tell me what my blood pressure was? And she told me. And then I said, is that good? Now, I knew it was good, but my point was, you probably shouldn't tell somebody a blood pressure without letting them know whether, you shouldn't assume that people will automatically know what the ranges are for blood pressure, because that's not really common knowledge unless you're somebody who really has an issue with blood pressure and is trying to stay in a target area. So my point was sort of like, it sure would have been nice if you had walked in the room, introduced yourself, asked how I was doing, said, hey, I want to take your blood pressure. Hey, guess what? Your blood pressure is 120/80. That's great. And I can see that your blood pressure was really good last time you were in here too. You're doing a great job managing your blood pressure. Do you have any questions about your blood pressure? And then I would have said, nah, I'm good. But that opportunity, was lost to have that interaction and to find out that maybe I'm really concerned about my blood pressure. Maybe high blood pressure runs in my family and I really need to share some concerns and get some advice about that. Reflective listening is just sort of repeating back what people have said to you so you can make sure you understand what they've said. So what I hear you saying is, it sounds like you're concerned about, it sounds like you're wondering if. This is really important because of the issues in communication that we all have, in that sometimes we think somebody is saying one thing and they're saying something completely different. When I asked the nurse about what's my blood pressure, a really good response for her would have been to say, oh, it sounds like you may have some concerns about your blood pressure. And I would have said, no, I just wanted to know what it is. But that would have opened the door, because she might have been thinking like, oh, she's got some real concerns. I really didn't. But it would have opened the door and I could have said, well, yes, actually, I am really concerned about my blood pressure. Also, when you have a talk with somebody, to be able to summarize what you heard them say and say, so what I hear you saying is you're having some real concerns with getting your son's teeth brushed because he's really fighting you with the toothbrushing. Now, parent may at that point do a couple of things. They may say, that's what's going on. Or they may say, no, that's not really the problem. I mean, he is fighting me, but I can deal with that. The real problem is this, Or when you reflect back what you heard them say, oftentimes when our words are reflected back to us, we realize like, ooh, that's pretty bad, isn't it? So oftentimes if you reflect back, so what I hear you saying is, you're having some real issues with getting your son's teeth brushed twice a day because he's really fighting you. Oftentimes the parent may just say like, oh, yeah, that's not a good excuse though, is it? I mean, he's 3. I really need to be the one in charge and just say, you need to do this. So often, a lot of different things will happen back, but the really important thing of reflective listening is for us to make sure that we heard correctly what they said. Because often when we reflect that back, people will say, oh, no, that's not what I meant. No, I'm not concerned about that. So this is what's really great about reflective, but it also helps people understand that they're being heard. There is no time you feel less heard than when you're with a medical provider or a dental provider, because you're in a stressful situation. They're tending to go through a quick list of questions. Often you get the perception that they don't want you to ask anything. They just want you to give the quick yes or no answer so they can work their way through the list. And so it is very empowering to someone to feel like, yeah, they're listening to me. Oh my gosh, this person is actually listening to me. They're not just going through their checklist of questions. So one of the ways that we can reflect back is if mom says, I know I should brush his teeth, but I just don't like upsetting him. We can reflect back. It sounds like you're aware of all the reasons you should be brushing his teeth, but it's hard for you when he gets upset. And then mom can either say, yeah, it's really hard. I don't like to see him be upset. And then we can say, well, I could, if it's okay, give you maybe some suggestions that you could try and see if parents receptive to that. Or, when we reflect that back, they may say, no, that's not what the issue is. The issue is, completely different. So reflective listening just really helps us get all on the same page. Plus, it helps the patient really feel like, okay, I'm being listened to. They're really listening to what I'm saying here. This is another example. I know I should be following my diet, but I'm just too stressed right now. This would probably be my example. And the provider can say, it sounds like you're aware of all the reasons you should be eating healthy, but this is a really stressful time for you. Then at that point, if they say, yeah, that's exactly right. When I'm stressed, I crave carbs and I crave sugar. And then we could lead into, have you ever been stressed like this before? And what helped you when you were stressed like that before? What were some things you did? And then we may lead into a thing of, well, at that point, I really made an effort to get out and walk half an hour every day, and that really helped. And then say, well, would that be feasible for you to do right now? So instead of us saying, well, if you're stressed, you really need to eat a healthy diet. You really need to be doing this. You really need to be doing that. And the patient just leaving and saying, okay, none of those things are feasible for me right now. Instead, we're going to guide them into the discussion of, yes, we've got to get your stress down so you can eat better. What do you think would work? What are some things you've done in the past that have helped you do this? So the S part of OARS is the summarizing. And the summarizing is you're going to kind of wrap up the whole discussion. So if I look at everything we talked about today, what I'm seeing is you're feeling really stressed. And as a result, you're making food choices that help you feel less stressed. And instead of doing that, you're going to start trying to put that half-hour walk into play every day and see if that doesn't help bring your stress down so that you can manage, your diet and be making healthier choices because you feel less stressed. Or the picture that I see today is that it's been really hard for you to get your son's teeth brushed because he's really fighting you. But we've got some ideas that you're going to put into play of letting him watch a small video while he brushes his teeth, or getting him an electric toothbrush because you think that's something that would really work with him. And you're going to check back with me then at the next visit, and we're going to see how this goes and maybe try some new things. But just wrapping up what's everything that we talked about, so you can just make sure you're on the same page, everybody's on the same page, and has put something into play that's patient-led, patient-driven, and is feasible for them to do given their daily life, given their income level, given the stressors that they face in their daily life, that you've put something into play that will work for them rather than our typical, oh, you're stressed? Here's a brochure on stress. You need to read this. Okay, next. And so it takes more time to do motivational interviewing, but you get better results. Scaling is a big part of motivational interviewing. You probably are really used to the pain scale. On a scale of 1 to 10, where's your pain right now? That's a really popular scale in every type of health. This is the same exact thing, but we're asking about change. On a scale of 1 to 10, where 1 is not important at all and 10 is critically important, where's this fall with you? So we're talking about, making dietary changes for oral health with our children. On a scale of 1 to 10, where's this fall? Because if the parent says 2, we got a problem. We've got to move them up the line a little bit. On a scale of 1 to 10, the second one is confidence. So on a scale of 1 to 10, how confident are you that you think this will work, or that you'll be able to implement this given your daily life? So we really want to ask people to scale where they're at. And as you know, you're probably really familiar with the pain scale, that's incredibly helpful. When someone comes in and says, you know, I'm having pain in my mouth, well, on a scale of 1 to 10, where 10 is, you know, intolerable pain, where's this pain falling? It's a 2. Okay, well, then we're probably not dealing with anything major here, right? If they say it's a 9, okay, we've got some major issues here. You've got intolerable pain. So it's the same deal, but it's how confident are you with behavior change? How important is this change to you? If somebody gives you a 1 or a 2 for behavior change, you can pretty much guarantee they're not going to do it. So then we want to ask them, why did they pick that number? So whatever change, whatever confidence or whatever willingness to make the change they give us, we want to say, why'd you pick that number? So why did you pick 9 and not a lower number? And they may say, well, you know, we were talking about things we could do to get my son to brush his teeth. Yeah, I think those will, I know my son, those things will totally work. I'm very confident that I can do this and it's going to work. If they pick a low number, we say, what would it take to move you to a higher number? So if we've talked about different things that they could put in place to help their son not be throwing a fit with brushing, and we say, well, how confident are you that with these things in place, you know, you'll be able to brush twice a day? And they say 3. And then you say, well, what do you think could move you to a higher level? And they'd say, well, you know, I'm going to need to find the money to buy that electric toothbrush we talked about. I don't have, you know, they're like $8. I don't have that money right now. And then we say, okay, well, let's, you know, drop that as an alternative right now. And let's talk about maybe we could try this instead. So it's really important to kind of scale where people are at. Because often people will really surprise you. Like when you're talking to them, you think they're not going to do this. And then you ask them on a scale of 1 to 10, how confident are you? And they're like, I'm a 9. This is totally happening. And they'll go out and do it. So that's extremely helpful. So in talking about, because I want to give you time for questions here. If you forget everything goes out of your mind that I've said today, just remember, tell me about. This is really quickly, I do a health behavior change model in my trainings, and just kind of hang on to this, but these are the common barriers that people face. They don't understand the positive and negative outcomes of the behavior. Norming, if people don't think everybody else is doing the behavior, they're kind of not inclined to do it either. Do they understand how to do it? If somebody's not brushing their child's teeth twice a day, make sure you're demonstrating how to brush on a mouth model. I can't even, you know, and I know hygienists are great at doing that. But I can't tell you how many times that I've met people that don't do a health behavior simply because they don't understand what they're supposed to be doing. It's not that they don't want to do it. They truly don't understand how to do it. Always be asking the question, is this feasible given your daily life? And then if we're working with low-income populations, we've got to really make sure that they can afford to do. Give them a free toothbrush, you know. And this is kind of my wrap up a motivational interview in this Maya Angelou quote. I've learned that people will forget what you said, people will forget what you did, but people will never forget how you made them feel. This is really the core of motivational interviewing. When people leave a conversation with you, you want them to leave feeling like they were a participant, they were heard, you understood where they were coming from, you understood the barriers they face in doing this behavior, and you're helping them work towards a solution together, not saying just do this, I'll see you in 6 months. Before we get into questions, this is an incredible reference for motivational interviewing. It has the most longest bizarre website address I've ever seen. So if you just Google desk reference motivational interviewing, this Sedgwick County resource should come up. It's about 50 pages of tons of examples of questions and things that you can get into if you're doing like a 3-day training. But it's a really nice resource to have if you just want to read through it and kind of refresh. Okay. Does anybody have any questions?
I will now open the lines for questions. So I'm going to unmute everybody. So just be careful of any sidebar conversations that you might be having or anything that you might be having going on. So all lines are now unmuted. And if you are just on the, or if you would like to type in a question to me, I can now take questions that way as well. So feel free to ask questions or type them in. Is there anybody that have any questions or comments for Holly?
Down there.
Victoria, can you hear me?
Yep.
Hi, I'm Chris Farrell from the Department of Health and Human Services, and thanks for the opportunity. But I do have one quick question.
Yeah, go ahead.
Holly, what happens when you go through this, tell me more, tell me about, and you still end up with people not wanting, that are just still like their arms crossed and refusing, or, they're still blocking you to even doing that? How do you gracefully get out of that?
Okay, yeah. There are some times where people are just really reticent to talk to you. And there is always a reason why. Will you be able to find it in the limited time you have with them? Chances are not. But typically the reasons center around one of two things. They're uncomfortable and they think they're going to get in trouble for something they've done. They think you're going to be all over them for something, like I'm going to bring my kid in here and they're going to be all over me because she's got crowns on her teeth or she needs to have teeth extracted and I don't want to hear it. So typically you're getting the I don't want to hear it behavior. That's what I call it. I don't want to hear it. You see this behavior a lot in your teenage children also. You go to talk to them, arms are crossed. I don't want to hear it. My best advice on I don't want to hear it behavior is to really try to diffuse it from the very beginning. I have found that if you come into the room really friendly, thanking people for coming in, telling them how nice it is to see them, complimenting them on their children, complimenting them on something, then it becomes much harder for them to have that I don't want to hear it behavior when they perceive you as somebody who's not going to give it to them. That you come across. And that's that Maya Angelou quote. It's not about what we say, it's about how we make people feel. So I always say, my joke when I was doing home visiting and working with families is that I was so nice that if you weren't nice back, it was like kicking a puppy. And really trying to defeat that you're the health provider, you're going to yell at me, you're going to tell me I'm not doing stuff right, you're going to tell me I'm stupid, you're going to tell me I'm a bad parent. Because the reality is, this is what these people have been through a lot. When you see that behavior, there's a reason for it. They've been treated poorly in a situation. They've been made to feel that they're not doing a good job. They've been made to feel a way. So when they come into your office, they're bringing past experiences with them. So often it won't happen the first time you see them. It may be the second or third time that you're able to break down those barriers. But that's where that affirming really comes in. Walking in, introducing, thank you so much for coming in. It's so nice to see you today. Just being very, very nice and giving that how you make them feel stuff to try to break down those barriers. And really being gentle and supportive. If they say, well, yeah, I know I'm not brushing his teeth. Say, okay, I know it can be really tough. It can be tough to get that in sometimes. Let's, and kind of affirming where they're at. Because the reality is we got to start where people are at. We want to move them, but we got to start where they're at. And the reality is their daily life, it just may be really tough to get this done. And we've just got to understand that.
Then there's another comment. It says, thanks, Holly, really enjoyed this. And then there was also another question that says, what is so special about the website?
Oh, this desk reference? It's just the best one I've ever found. A lot of motivational interviewing is really dense, and it's hard to understand the way it's written. This desk reference is for practitioners. So what it does is it gives tons of questions, examples of ways you can phrase questions, examples of ways you can do a summary, examples of affirmations. I have nothing to do with this. I didn't write this. I just found it. But it's the best one I have found for practitioners to give you lots of like really great examples that you can put into practice tomorrow. Because like what we did here an hour, or even when I do my 3-hour trainings, man, that is not enough. It's an intro, but this is something you need to do day in, day out to get used to these communication techniques. And this desk guide just gives you pages and pages and pages of examples of ways you can do things. So it's really designed for practitioners. It's not all the theory and research. It's here's how you do it.
Okay, thank you. Are there any other questions or comments?
Thank you.
Okay. If we don't have any other questions or comments, you can always feel free to email them to me, or you can email them to Holly, and or you can indicate them on your evaluation too, and I can always pass them along to Holly that way as well. Go ahead, and I won't take up any more of your time. I know you guys are probably busy, and we'll go ahead and sign off.
Thank you.
Thank you for joining us, and thank you, Holly, for presenting.
Yes, thank you very much for joining us. And you're welcome for presenting. This is my favorite topic. It wasn't a struggle for me.
And then we had another comment. It says, thank you for your time and the information.
You're welcome.
And I did record today's webinar. I will put it up on the website as well.
Mhm.